Techniques for coping and adjusting to a new health situation. Hello and welcome to this video guide about adjusting to a new health situation. My name is Mark and I am the lead cardiac rehabilitation practitioner at University Hospitals Bristol and Western, or UHBW. In this video, we will explore techniques for when you feel emotionally overwhelmed whilst adjusting to a new health situation. The information presented will include data from research, experiences from other patients, and tips to help you make changes. Overview. This video will cover common emotions that you may be experiencing following a new diagnosis and tips on how you can cope with these. If you have any concerns about your heart condition, please speak to your GP or cardiac team. There's also further information on your trust websites, as well as the British Heart Foundation and Pumping Marvellous sites. Emotions. It's important to acknowledge that it's normal to feel a range of different emotions during a time of uncertainty or change, including the diagnosis of a new health situation. These emotions might include fear, anger, sadness, anxiety, or loneliness, all of which we will look at in more detail today. Fear. After any health change, it's normal to feel afraid and unsure of the future. Every person with a heart condition experiences some degree of fear, but it's important to know how to cope with these feelings during your recovery. To help manage your worries, it can be helpful to start by getting correct and complete information. Number one, talk to your healthcare professionals about your fears. Ask them what you can expect over the next few days, months, or years. It might be helpful to write down questions you would like to ask before going to an appointment, to make sure you don't forget anything. 2. Use positive self-talk to help overcome your fears. For example, thinking of a mantra you can repeat to yourself in these situations. Something like, I can do this, or I'm going to be okay. Number 3. Try to talk about your fears with a close friend or family member. When you voice your fears, you open the door to getting help and information that can make you feel better. Anxiety and sadness. Anxiety and sadness are other common feelings to experience when overwhelmed. When you have a change in health, it's normal to feel these emotions. When you're anxious, you may feel nervous, tense, and irritable, and have difficulty sleeping. These feelings may get better as you learn more about your condition and how to manage it, but if they continue or interfere with your normal activities, it's important to seek support from your GP. Confiding in someone you trust, such as a family member or friend. Those close to you may already know you are feeling sad or anxious and want to support you. Even if you don't know what's causing your anxiety or sadness, talking about it may help. Being active can help take your mind away from your worries, and it releases endorphins that can make you feel better. Even short, gentle walks are beneficial for your physical and emotional well-being and can alleviate some of your stress. But please check with your cardiac rehab team about what level of physical activity is appropriate for you. Take time to relax and do things that make you happy. It's important to be in the present moment and focus on small things you're doing each day. Recognise that it's normal to feel sad or anxious during a time of change and uncertainty. For most people, these feelings will improve in the first weeks and months after diagnosis or an event. Loneliness. It's easy to feel alone when you receive a change in your health. You're the only one who knows how your illness is making you feel, emotionally and physically. Feeling lonely can be worse if you feel you have no one to give you support or you feel you can't ask for it. Try to reach out to others. You may be pleasantly surprised at how many people are willing to help or spend time with you. Start by making a list of all the people you can call. Think of family, friends, neighbours, co-workers and healthcare professionals who may be able to support you. Think about why you feel lonely or isolated. Use this checklist to help you. 1. I feel I don't have enough contact with people. 2. I'm not sure I know how to ask people for what I need. 3. I feel I will bother someone if I ask for help. 4, I worry that people will get tired of me asking for help. 5, I'm afraid people will say no if I ask for help. Don't give up if you don't make a connection on the first try. Friendships and support networks take time to develop. A great option for cardiac patients is to join a support group with other people going through similar health situations. You can find links to these groups on our trust websites. Anger. Many people with a heart condition feel angry about their new situation. It can be frustrating when having to make changes to your daily activities or lifestyle, especially in the first few days and weeks. These feelings are normal and are experienced by many people with similar situations. Be understanding and patient towards yourself. This is a very challenging experience to go through, and it may take time for you to adjust to changes. When things heat up, call a timeout. Step back from the situation, take several deep breaths to calm yourself down. You may need to move away from the situation before you can come back to deal with it. If your frustration or anger results from contact with others, try and control how you react physically. Try not to sigh, speak loudly, shake your fist or point your finger. When you feel angry, use a 3-step approach. Stop, ask yourself questions, then react. The first question is, would a jury of people think I should be angry? If the jury says yes, ask yourself, is this a situation I need to fix, and can I fix it? If you decide you must fix the situation, wait until you cool off and then take action.
We will now hear what some of our other patients had to say about their experiences.
My name's Lynn and I'm 73. Right at the beginning, I didn't know I had anything wrong with me. And then one night, I collapsed at home on my own. So I just phoned 111. I could go to the surgery. They called me back in and he's like, you are having a heart attack. I'm like, you mean I've had a heart attack? Because I had visions if I was having one, I would have collapsed on the floor then and there. I need to know you are having one. I was stunned. I think I was scared. I was scared. That was the thing, and being on my own. And that's why I didn't want to do too much. In fact, I didn't do much. For some reason, I'd phoned my doctors. Again, I got a nurse. She realised I wasn't going out. And I said I wasn't going out. And she said, I think you should start going out. So just walk up the road and walk back, but keep your house in sight. You know, the confidence bit. I thought, oh, okay. So I did that, and I just gradually started going a bit further. And I thought, oh, I've got this far. I can walk around the block. And it gave me that little bit of confidence to keep going.
Sometimes you have to get out the house. I've taken up fishing again, so I go fishing on and off now. And that's very relaxing, I find, you know.
Your mood changes as well, which is really strange. You tend to, personality-wise, at the beginning of it, I tended to be a little bit more aggressive, a bit frustrated with things, I think, really. I didn't realise I was doing it at the time, but it settles down after a time. So it's not a permanent thing.
I don't think I was angry. Well, I think maybe I was in the beginning, but then I accepted it because I was cross. Do you know what? I've looked after myself all these years. Deliberately, I'm on my own. I don't want to be ill. And then I go and have a heart attack. How can this happen? But at the same time, I then sort of, well, do you know what? If you hadn't looked after yourself, it could be a lot worse. So I then sort of started looking at the positive side. Actually, it was a good job. I did look after myself and ate the right foods, etc., and had exercise.
One of the biggest things I can do is talk to people. The worst thing to do is sit there and let your mind play tricks on you and start thinking, because you will always think the worst. And I went in for my pre-op. I spoke to the nurse and the actual surgeon as well. And they give you a lot of time going over what they're going to do. And they ask you questions. And the best thing you can do is, rather than just sit there and say no, is actually say, yes, I was worried about the scar. I was worried about the pain, the time of recovery. And we discussed all of it in detail. because it's what they do. So they know what you're going to go through, whereas you don't.
When I first went into the hospital and they said, no, and I'm like, oh no, please don't tell me I've had a heart attack. I don't know why, because I was in the care of professionals. But yeah, I did feel a little bit worried then. But now I'm not. I've had follow-up appointments that I've obviously kept. So they've just taken real good care. Every aspect, from being able to talk to somebody, the secondary prevention clinic. I've had appointments with them, and they just check to see that everything's going okay, that I've got no worries, no concerns. It's absolutely fine. And then obviously with doctors, they're always there at hand. So absolute trust in them.
Where I've had terminal illnesses, it's made me enjoy my life more than what I ever have before. It's when you're close to death and you survive it, it gives you a gift. You know what life is and you feel it. You're willing to go out your way, i.e. this group, just to try and help others. It's not all about me.
Further support. If you have an urgent mental health concern, you should contact your GP, who can refer you to appropriate mental health support. You can also call 111 for mental health advice. If someone's life is at risk, or you do not feel you can keep yourself or someone else safe, please call 999 immediately. If you're over 16 years old and would like to access support for your mental health, you can self-refer to your local IAPT service. IAPT also have self-help guides on their websites, which you may find helpful. A selection of further resources and support will also be listed along with this video on our website. Hope. Many of the emotions you may feel after a heart condition diagnosis are difficult, even unpleasant. But another common feeling is hope. Even people who are very ill say they feel a sense of hope, if only for a moment, an hour or a day. Learning as much as you can about your condition and treatments is a good way to feel more hopeful. Monitor your progress towards your treatment goals and celebrate your achievements, no matter how small they may feel. Knowing that you're actively managing your condition can give you hope for an improved health. Sharing your experience and advice can also give you hope. Get to know other people with heart conditions, such as someone you met while you're in hospital or through a support group. Ask them what keeps them going and share your own encouragement.